When was the last time that you thought about how you would die? This isn't something that's very common to think about, but it is something that all of us should at least think about once. Physician-assisted suicide is not nationally legalized in the United States, and this is a problem. I think that it should be legalized throughout the United States in the land of the free, giving people the freedom to choose how they should die. By the end of this speech, I plan to persuade you that physician-assisted suicide is needed to be legalized nationally by telling you what it is, who it can help, some of the pros, and my personal beliefs and experiences with it. I'm going to start off by what is physician-assisted suicide, also known as PAS. PAS is defined by the voluntary termination of one's own life by administration of a lethal substance with direct or indirect assistance from a physician. It was written by a businessman, 2 lawyers, a nurse, and a doctor. Whenever it was written, all these different professionals came together and they helped give a very clear and detailed look into what it meant and what it was to stand for, and they took every aspect of it and wrote it out perfectly, where even the non-professionals, the non-medical professionals or legal professionals could all understand it. Who would physician-assisted suicide benefit? According to the Journal of Loss and Trauma, in order to qualify, you must be at least 18 years of age or older, a resident of the state, capable of making your own choices, so in your right mind, not convinced by anybody else or anything like that. You must have a diagnosis of a terminal illness with death within at least 6 months. Prognosis is going to be bad. It's going to be you're going to not make it within 6 months. And you must have 2 verbal requests to your physician with at least 15 days between the first and the second one. You must have a written request to your physician that requires 2 witnesses to sign it. You must have 2 physicians go through your labs and your test and run their own labs and their own tests and confirm that the diagnosis, meaning what disease you have, and the prognosis, meaning what's going to happen, how bad it's going to be, and how long until it's going to kill you, all have to match and they all have to agree. And then a physician must explain every other option to you. Palliative care, where they just keep you comfortable and keep you pain-free and let you die. Then they have the hospice, where they do the same thing, but mostly it's done at home and with your family's assistance. And they have skilled nursing facilities, they have treatments they can usually fight and try, research, and all these other different things. They have to go through all those with you before you can make this decision. In 1996, it was first legalized in Oregon, and since then, it has now been legalized in the state of Washington, Vermont, Montana, and California. There is several different states that are pushing to get it legalized, but the federal government decided that it was not something that they should enact on, that it's something that each state should decide whether they want it to be legalized or not, which is why it's such an important thing. Because if we are going to have this as an option for people, we have to do it on our state level and fight for our state and for our people are here. And according to the Death with Dignity website, of the people who have used the physician-assisted suicide since it started, most of them were 65 or older, most of them were white, almost 50% of them had at least a bachelor's degree in education, so a bachelor's, master's, doctorate's own up, and 78% of them had a diagnosis of cancer, meaning they were going to die because of cancer. The benefits of physician-assisted suicide is a good death, which is defined as one that allows a person to die on their terms, pain-free, and with dignity. Controlled, this is pretty good compared to the rate of suicide from terminally ill patients. Instead of having a patient who commits suicide because they know they're going to die, this allows the family and the patient to go through the right process, because there's many insurance companies that will not help pay if suicide is what caused the death, but if it's physician-assisted suicide, which is legalized, then that's a whole nother story with the insurance. My opinion. I'm a medical professional. I'm a nurse. I have helped bring children and babies into this world. I have been with patients as they've taken their last breath. I have cried with patients and with families. I have gone home and cried for my patients and their families on my own. And through all of this, the one thing I have learned is to never take anything for granted. And I've also learned what I do and do not want out of life in many different aspects, but particularly in death. My grandfather was in the hospital in 2009 when he suffered a major stroke. The facility did not know that he was a DNR, meaning that they were supposed to just let him die when his heart stopped. But they didn't know that, so they did everything in their power like they were supposed to if they were unsure, to bring him back to life. So my dad and I spent 3 nights in a small hospital, in a small room, in the small ICU, watching as my grandfather's lifeless body laid there, being kept alive by machines. That is my last memory of him whenever I think of him, is him in that hospital room, lifeless, on machines. And not that physician-assisted suicide could have helped in my grandfather's case, but it could help many other patients and many other families have a different last memory. Instead of their last memory being their family member and their loved one not looking, acting, or being at all who they once were, these people can have the option to sit up here and say, I want to end this before it gets to that point. So your last memory of me is how I am today. And that's why I support it. And physician-assisted suicide should be legalized nationwide because it was formulated by several different medical professionals. It's been around, we've seen the studies, we've seen the results. It is used more than what it once was, but it still isn't a gateway per se. It has very strict criteria which allows it to not be a gateway. And it is an American right to die a good death. In America, we are known for freedom. We can choose to identify as whatever gender, race, and ethnicity that we want. We can choose who we want in our life and who we don't, what we want to do and what we don't want to do with our life. With all of these choices and all of this freedom, but we can't all choose how we want to die. That is why we need to go to our state legislators and fight for physician-assisted suicide, so we have freedom in all aspects of life. Thank you.